I'm Olivia Masuka and I'm playing the nurse.
Hi, my name's Olivia Jabreen and I'll be playing the doctor.
Hi, my name's Cecilia Berrigan and I'll be playing the lab technician.
Hi, my name is Steph Mangles and I'm playing the patient.
Do you have an appointment?
No, but I need an appointment now.
Okay, let me see what I have available.
What? It's not like I have the plague.
Okay, I have an appointment available in 30 to 40 minutes. Does that work for you?
If it's the best you can do.
Okay, I'll need your first name,
Stephanie,
your last name,
Mangles,
age,
17,
address.
123 Ledgewood Drive.
Okay, thank you. Please take a seat and wait for your name to be called.
Stephanie? Took you long enough. Come on. What brings you in today?
Well, I don't feel very well. I have an awful fever, and I have this really bad cough. I've been sweating for a while now, too, and I feel weak.
Okay, I see. Allow me to take your vitals. Can I see your arm, please?
What's this?
Oh, I don't know. I meant to ask you about that as well. I'm going to go get the doctor.
What? It's just like an oversized pimple or something. You don't have to get all scared. Gee, aren't you supposed to be a nurse?
So her pulse is at 65 beats per minute. Let's see, her blood pressure is 120/80, normal. She seems to exhibit a fever. Her temperature is nearly at 100 degrees Fahrenheit. Oh, and she seems to have something on her neck, like a bubo. I thought you should make the call.
Can I see your neck, please? Oh my, I think you might be right. Let me go get the lab tech in here before we try to treat this. This is our Celia, our lab technician. Can you please show her what you showed us so she can determine what tests we have to run?
Why don't you just put me in a museum already?
Oh, God. I don't think I've seen something like this since I lived out west.
I was just out west last week.
What were you doing out there?
I was on vacation visiting my brother, and we went on a camping trip. It would have been great if there hadn't been so many pesky bugs. The mosquitoes were the worst.
Are you sure they were mosquitoes?
What else would they be?
Fleas? Infected fleas?
I'm not a dog.
We need to move Steph to a more secure location. I don't think that's what she meant. Fleas can carry bacteria known as Yersinia pestis, which can cause a disease that we like to call the bubonic plague.
You shouldn't be here. We should quarantine her. It's highly contagious.
I think there's evidence to believe that this could be the bubonic plague. In any case, though, we need to run some tests before starting to treat her. It could be something equally as serious. I'm going to need her for a lymph node aspirate, maybe a blood culture, and some x-rays to make sure we don't have another form of the plague.
Very well then. Follow her for the lab tests, and when the results are in, we'll come back and discuss them.
The results are in. We have good and bad news. The good news is we figured out what you have. The bad news is we confirmed that it's the bubonic plague.
What? What even is that? How do you know? Am I gonna die?
The bubonic plague is an infestation of the bacteria Yersinia pestis that I told you about earlier. It is very common in white people under the age of 20 like yourself. If left untreated, 50 to 90% of the cases are mortal, but if treated, like we plan to do with you, your mortality rate will lower to about 10 to 20%. We will do our very best to treat you. You are one of the few people that has contracted this infection this year. There are about normally 10 to 15 people in the US per year that get it.
But are you sure? Like you said, only 15 people get it per year.
Well, it can be seen right here in the lab results. I conducted a lymph node aspirate, which allows me to take a culture of the organisms that are found in your bubo, and I found Yersinia pestis in the cultures, indicating the cause of the bubo is the bubonic plague. In the blood cultures, I was able to make sure that bacteria had not grown as a cause of the systemic plague. Yep, no. And through the x-rays, I was also able to double check to make sure that you had not gotten the pneumonic plague. Luckily, we caught it before it got worse, and now we can start to treat it.
So how do you treat this plague, doctor?
Well, in order to treat this plague, we'd have to give her an antibiotic. We will give her gentamicin and fluoroquinolones. She'll have to take those once a day until the fever subsides for 2 days.
How long would that normally take?
About 10 to 14 days.
All right, I'll let her know. One more thing.
Yes?
If she asks if she's going to be okay, what do I say?
Remind her that the prognosis looks good. However, the mortality rate can go from 10% to 50%. With the treatment, we hope, she follows her treatment plans very carefully and that her mortality rate decreases.
All right, I'll go tell her.
So what can I do to prevent this from happening again?
Okay, for one, be very careful when you go to visit your brother again. Fleas carry bacteria that causes plague. You are at risk if you go camping, so wear repellent. Or even if a cat or dog that's around comes inside the house with fleas. Rodents also carry this bacteria, so make sure you keep away from dirty places like these that may be infested.
I'll definitely keep that in mind. I already called my brother and told him to go to the doctor. So can I go home now?
Well, yes, but I'd like to see you back in 2 weeks just to make sure you're okay.
Okay, I'll make an appointment on my way out before picking up my medicine.
See you then.
So how have you been doing?
Pretty good. The fever and sweating have gone away, and I don't feel nearly as weak. And the buboes, or whatever you called them, are gone.
Perfect. Can I see your neck, please?
Sure.
You're right. It seems like it has gone down, which is a very good sign. Did you take all your antibiotics as directed?
I did.
Perfect. Looks good then. I think you're all set to go.
Thank you, doctor.
Oh, wait. When I talk to So what brings you in today? I think it's a video. Okay.
You did it 3 times, it was 2 times.
Very well then. Follow her for the lab tests and return back to this room when the results are in. Crap, that was so bad. Hold on. So, how have you been doing?
Well, the fever and sweating have gone away, and I don't feel nearly as weak. And the buboes, or whatever you call them, are gone.
Perfect. Can I see your neck, please? You're right. It does seem to be gone, which is a very good sign. Did you take all your antibiotics as directed?
I did.
Looks good then. You're all set to go.